Well, over the last 18 months, we found that the COVID pandemic has had a really significant impact on lung cancer. When the pandemic first started back in early 2020, people heeded advice to stay at home and, to look out for symptoms. And of course, the symptoms of lung cancer significantly overlap with the symptoms of COVID. A cough, breathlessness, generally feeling unwell. And because people, knew the health services were very, very busy, they weren't coming forward necessarily seeking advice. So many people, we believe, who thought they had COVID may have had lung cancer, or may have had both, of course. And what that's resulted in is we saw a big fall in referrals for lung cancer. So if we take 2019 as a baseline, we saw about up to a sort of 70% drop in urgent referrals in the first few months of 2020. And then this is gradually and slowly picked up again, affected somewhat by the different lockdowns. And we are approaching the sort of previous baseline again, but we're not quite back to where we were. And unfortunately, we know that there have probably been many thousands of people whose lung cancers were not diagnosed. Sadly, many of those have probably died. We're also seeing, as a result of this, many people coming forward now with symptoms, who've had symptoms for a considerable period of time, and their disease is probably a lot more advanced than it was. In the absence of a formal lung cancer screening program, many of the patients we see with early stage disease, stage 1 and stage 2, are actually patients who have been picked up by chance because they've had scans done for other things. And one of the other things we noticed with the lockdowns and with this, this change in behavior, was that people weren't having routine scans for other things. And those routine scans, therefore, weren't picking up the incidental lung cancers. And so the numbers of early stage lung cancers we were seeing, which are often asymptomatic, also went right down. And I'm afraid this is a legacy of the pandemic. And that's where we're trying to get back on track now.